All right, I think we'll get going here. We had a wonderful morning, and we're going to have a great afternoon, so thank you all very much for staying with us. It's my pleasure now to introduce the moderator of our next session this afternoon. She is Dr. Linda Myers. Linda is a member of the Roundtable on Obesity Solutions and is a senior science advisor for the American Society for Nutrition. Until June of 2013, Linda directed the Food and Nutrition Board here at the IOM, where she spent a great deal of her time involved with the IOM's work on obesity prevention. So we're delighted that Linda's with us this afternoon. Linda?
All right, now that we're all energized, for the next hour, we're going to think about institutional strategies for promoting physical activity. And two experts that are going to lead our thinking are Allison Nihiser, who is a health scientist in the school health branch at the Centers for Disease Control and Prevention, who will talk about evidence-based and innovative strategies for school-based physical activity. And following her, Nico Pronk, who is a Roundtable member and the Vice President for Health Management and Chief Science Officer for Health Partners in Minneapolis. He will talk with us about physical activity promotion at the workplace. Design matters. So, Allison?
Thank you, Linda. And I would like to thank the Institute of Medicine's Roundtable on Obesity Solutions for inviting CDC School Health Branch to present today. And I'd also like to thank Russ, Amy, and Jamie for setting up this presentation so well today with all the research that they already provided around policies on school physical activity, as well as information around that. So the evidence around school physical activity was synthesized, as Russ mentioned, in the mid-course report developed by the Physical Activity Guidelines for Americans. This came out in 2012. And really one of the key findings was schools are an important setting to address physical activity and increase physical activity levels among youth. More importantly, we saw that there was strong evidence to recommend to schools to implement a multi-component approach to school physical activity, so having two or more components, as well as ensuring that physical education is essentially a part of that multi-component approach. And with physical education, we want to ensure that there is enough time in the school day for physical education, as well as keeping students active for the majority of class time during physical education, which I understand was one of the concerns that was brought up earlier. In addition, there was enough evidence to recommend implementation of that active transportation, walking and biking to school. And as Russ pointed out, emerging evidence around activity breaks. So classroom-based physical activity and recess, really how much can those, what opportunity is there for those specific interventions to add more physical activity time to the school day? So the recommendation from the mid-course report on a multi-component approach really helped to inform and strengthen CDC's and Shape America's recommendation on a comprehensive school physical activity program. Comprehensive School Physical Activity Program is the national framework for addressing physical activity in schools, and the point is really to improve the quality of physical activity and physical education throughout the school day. Ultimately, the bottom line is we want schools to use this program to guide their physical activity programming, and so that we can ultimately have as many opportunities for students to be active throughout the school day, before and after the school day, so that they can achieve that goal of 60 minutes of daily physical activity each and every day. The multi-component approach, the Comprehensive School Physical Activity Program includes 5 different components. physical education as the foundation for a comprehensive school physical activity program. Physical activity during the school day, physical activity before and after school, having that staff involvement where staff are both serving as role models for living healthy lives as well as helping implement and energize that comprehensive school physical activity program, involving the families, and ensuring that the communities are involved to help so that they can also help provide additional resources for schools. CDC and Shape America have identified a process for implementing comprehensive school physical activity programs, and that includes identifying that champion for physical activity in the school, typically the physical education teacher. That champion then can recruit others from the school community to lead the school through an assessment of the physical activity opportunities throughout the school day that already exist, as well as the implementation and evaluation of these programs. So who's doing this? Well, CDC collects national data on comprehensive school physical activity programs, and we learned that in 2012, no state had any more than 30% of their schools offering comprehensive school physical activity programs. So we really have a lot of work to do in this area, and we have a lot of room for improvement. And only 12 states were actually achieved that 21 to 30% of their schools implementing comprehensive school physical activity programs. States can help with providing support to schools. For example, in 2012, 49% of states provided professional development or offered funding for professional development to the physical education teachers in their states on the development, implementation, and evaluation of comprehensive school physical activity programs. So we really can use, there's some current national initiatives that are ongoing that can help states, districts, and schools activate these programs. The 3 national initiatives that support comprehensive school physical activity program their goal is to disseminate and implement these programs to improve the quality of physical activity and physical education in schools. And these initiatives are really innovative because they are working together to have far-reaching impact on schools across the country. The 3 initiatives are CDC's state public health actions to prevent diabetes, heart disease, obesity, and promote school health, the First Lady's Let's Move Active Schools, and the President's Council on Fitness, Sport, and Nutrition Presidential Youth Fitness Program. In 2013, for the first time ever, CDC funded all 50 states to address physical activity in schools. Specifically, these 50 states are actually funded to address physical education policies at the state and district level and recess policies at the state and district level. 32 states receive additional enhanced funding to work with targeted districts on providing professional development and technical assistance on comprehensive school physical activity programs. This funding cycle is for 5 years, and these states are required to adhere to some strict performance measures, including the data that I showed earlier on what percent of schools in their state are actually offering comprehensive school physical activity programs. Let's Move Active School is actually working directly with schools to implement comprehensive school physical activity programs. And any school can sign up to be a Let's Move Active School. With this program, Let's Move Active Schools identifies a physical activity champion who signed themselves up to be a Let's Move Active School to go through an assessment and then to empower that champion to promote physical activity across their school day. This program has a number of free resources, including online tools, professional development, targeted professional development, and training directly to these physical activity leaders. The purpose of the Presidential Youth Fitness Program is to improve the quality of physical education in schools by improving fitness education. There's a three-prong approach to the Presidential Youth Fitness Program. Schools that sign up conduct assessment using FitnessGram. They receive professional development and trainings from the Presidential Youth Fitness Program on implementing fitness education into the curriculum and how to communicate about the assessments. And then that third piece is providing recognition to the students so that they are motivated to continue to improve their levels of fitness. Again, any school can sign up to be part of the Presidential Youth Fitness Program. So let's take a step back now that we talked about this comprehensive school physical activity program and the three initiatives. And what does this look like? Well, all three initiatives are actually coordinating in a very unique way, and they're supported by a number of organizations, both in the health and education arena. And they're working together to get that widespread implementation in schools across the country. So they're working across all 5 of these components. You see CDC and then as many of you in the audience, as well as a number of individuals in academia are working on their research to address comprehensive school physical activity programs and really look at how schools are adopting these programs and how they're being implemented, what additional supports are needed. Then that research is translated so that national initiatives can take that information and disseminate it out to schools across the country, schools of all levels, elementary, middle, and high school. Then the key piece is making sure that schools can implement these comprehensive school physical activity programs. And so one of the common components across all 3 initiatives that you may have picked up on is professional development and training. The Presidential Youth Fitness Program and Let's Move Active Schools are providing that training directly to that physical education teacher or physical activity champion in the school. And then the CDC initiative is targeting that training down to the district level. All 3 initiatives also further have comprehensive evaluation, very rigorous evaluation components to them. And with this evaluation, we're learning what barriers are in place for implementing these programs. How well can these schools adopt these programs? Are these 3 initiatives, how well is the dissemination occurring? And so ultimately that evaluation informs the research. The Presidential Youth Fitness Program actually just released their evaluation on the year 1 results, and that is available on their website. So now we're going to talk about some innovation within the comprehensive school physical activity program model. Let's talk about what's happening with physical education. Physical education should be the foundation of a comprehensive school physical education program. And as the mid-course report pointed out, ensuring that there's adequate time in the school day for physical education and that we're getting students more active during physical education. So there's a big push to transform physical education so that it is streamlined across the country and all schools are implementing this quality program with 4 essential components. Shape America identified these 4 essential components for physical education. And once we've transformed and streamlined the approach, we hope that students are benefiting from a quality physical education program that keeps them active and teaches them about the supports of physical education. So the 4 components are policy and environment. So ensuring that there's support available for physical education so that students can engage in physical education as they do any other academic subject. This means having enough time for physical education, ensuring that there's enough facilities available for physical education, the appropriate facilities. Curriculum. Physical education course should be informed by a curriculum, and that curriculum should be based on national standards. Ensuring appropriate instruction, meaning hiring qualified physical education teachers who can keep students active for the majority of class time. And student assessment, We want to make sure that the students are actually being assessed to see are they indeed achieving the national standards. The Presidential Youth Fitness Program is actually providing training directly to physical education teachers on appropriate practice and appropriate instruction for physical education. Another area of innovation is recess in secondary schools. So really, how can we add more physical activity during the school day for those middle school and high school students? We learned yesterday that as students age, they tend to engage in less and less physical activity. So recess in secondary schools may be an opportunity to add more time to the school day to those older adolescents. We're all very familiar with the recommendations around recess in elementary schools, but we need to start focusing on, is this also an opportunity? We need to focus on, in practice, is this also an opportunity for middle school and high school students? More research is needed in this area. For example, what is appropriate for recess in secondary school students? How do you manage these students, making sure there's appropriate supervision? How do you promote this in these programs to these adolescents? And do these programs indeed result in increased physical activity and hopefully increase academic achievement outcomes that we see in elementary school students? Shape America will be coming out with a policy statement on K through 12 recess later this year. And now let's focus on what innovation is happening in that before and after school arena. As the mid-course report identified, there's enough evidence to recommend schools implement active transportation to schools, to and from school. The point I want to make around active transport is that making active transportation programs can really help students engage and practice using walking as a mode of transportation and using walking as a mode of physical activity. There's a national push right now to promote walking as physical activity because it's easy to do and most people can engage in walking. Currently, the Office of the Surgeon General and CDC are working on a call to action on walkability and the promotion of walking as a physical activity, and they intend to look at strategies specifically in educational institutions, as well as a number of other settings. Now let's focus to after school. More research is needed in the after-school setting to see the appropriate ways for adding more time of physical activity into the after-school setting. That being said, over 10 million youth engage in after-school programs. So the impact that we can have targeting these programs can be great and can help a great number of students actually achieve more opportunities for physical activity. We already know that standards exist. The Healthy Out of School Time Coalition has developed healthy eating and physical activity standards for after-school programs, and they've already been adopted by a number of organizations. So seeing how these after-school programs can really promote physical activity will help all of the students in these programs. The Comprehensive School Physical Activity Program has innovation within the components. And we currently have 3 national initiatives taking an innovative approach to have a great reach in schools across our country. We are no longer taking the siloed approach to school physical activity and looking at each component separately and how each component can promote. We're looking at how this multi-component, these multiple offerings, really can help students achieve 60 minutes of daily physical activity. A number of free resources exist across all three initiatives that I pointed out, as well as a number of other national organizations who are promoting physical activity in schools. I do want to highlight a couple of the resources that schools and districts and states can use to help schools adopt and implement comprehensive school physical activity programs, including a guide for developing comprehensive school physical activity programs, which allows schools, provides them with a template and process for the development, implementation, and evaluation of these programs. Our School Health Index, which allows schools to assess their health policies and practices across a range of health topics, including physical activity. Our school health guidelines to promote healthy eating and physical activity, which includes a number of practices that schools can use to implement more opportunities for physical activity throughout the school day. And our physical education curriculum analysis tool. This tool allows districts and schools to assess their physical education curriculum to see if it indeed is aligned with national standards. And this is currently in the process of also being updated to reflect the updated national standards by Shape America. So I want to thank you for your time, and I look forward to discussing questions in a little bit.